So we have a problem that could present a problem in this whole vaccine rollout. So as the vaccine rollout begins, rich Californians seek ways to get on the very top of the list. This is by Matthew Allen. One patient even offered as much as $25,000 to get early access to the vaccine produced by Pfizer and BioNTech. So this could be a problem for people who are just expecting to get this vaccine for free. I also heard, I don't know how true this is, that there could be a problem where people may get sent a bill after being vaccinated. And so if you're expecting it to be free, and all of a sudden a bill shows up, that could be another issue. And they're saying it could be the same thing that happened when people were getting the coronavirus testing. How some people were complaining they were getting sent bills. It was supposed to be free, but they were still being billed for being tested. And they were told in the beginning that it was a free test. And it turns out they were still being sent bills. So you have to look more into that. So the first round of vaccinations for COVID-19 are going out in limited numbers as the U.S. daily death toll reaches new highs, and some Americans are willing to pay the top dollar for quicker access to the shot. So in California, 327,000 vaccine doses produced by Pfizer and BioNTech are received earlier this week, and many wealthy residents are postponing health institutions to cut the line. So according to CNN, most of the vaccine doses sent to California are going to the frontline healthcare workers. However, several doctors are disclosing that they have been receiving money offers from people seeking to get a hold of inoculations for themselves. So Dr. Jeff Toll, a Los Angeles physician, stated that a patient offered Cedars-Sinai Medical Center $25,000 to get access to this vaccine. So many of Toll's patients are entertainers and executives. So I think one of the difficult things is for physicians who take care of these high-power people to be able to say, no, you have to wait. Told the outlet. These people don't usually have to wait because their money is what talks for them. So my concierge MD, a health facility in Beverly Hills, California, has been getting numerous calls from wealthy clientele willing to pay any amount to bypass waiting for a dose of potentially life-saving shot. Dr. Abe Malkin, concierge MD's founder, said that some of the patients offered to give charitable contributions in order to get themselves bumped up in the line. So this eagerness to receive a vaccine is understandable, of course, but the death toll from coronavirus is nearing 314,000 in America, with over 22,000 of those coming from California, according to the data compiled by Johns Hopkins University Research. So on Wednesday, the nation had its highest number of virus-related deaths with 3,611. So despite the vaccine's presence and more in the pipeline, it will take months for the remedies to reach the masses. So this is where the problems are going to start beginning, folks. So from what I heard, we were in the middle of the third wave. And things are going to start probably getting ugly because people are going to be doing what we see here. In this article, they're going to be trying to rush to get the shot, rush to get bumped up in the line, paying cash. I've also heard that it could be a problem where people thinking they're getting the shot free and they might be billed. That could be a confusion, and there's supposed to be more in that. It's going to be crazy, but the U.S. Food and Drug Administration authorized Pfizer vaccine for emergency use on December the 11th, but the pharmaceutical company has stated that the Trump administration has reduced allocation of the vaccine in several states for the next week, as reported by NPR. The FDA on Friday cleared a second COVID-19 vaccine produced by Moderna for emergency use. And so in a statement, Pfizer said, "We have millions more doses sitting in our warehouse, but as of now, we have not received any shipment instructions for additional doses." So among the states expected to see a cut in vaccine dosage shipments are Connecticut, Georgia, Montana, Michigan, and Nevada. And so that's pretty much the article. And it looks like it's now starting to get into a game of who's going to be in line to get the cure-all shot. And who's going to spend the most money, who's going to accept it, and what types of confusions are going to happen when people do get access to the shot. Is there going to be a bill sent to their home? I know they didn't say that in this article, but I did hear that that could be a possibility. And I believe that they will somehow work that out where people won't have to pay for it, because I was told it was supposed to be free for all Americans. But this makes it complicated when you have wealthy people trying to get bumped up in line and offering to pay $25,000 to get early access just to be moved up in line. It's just like when people are wanting to be moved up on a list for organ transplants, or they want like maybe a kidney or liver or a heart or something like that, and they are offering large amounts of cash so that they can be moved up in line to get that organ, that life-saving organ. And so this is but one of many of those type of issues, and this is pretty crazy. It's starting to get pretty crazy. So having said that, I'm going to let this video go. I am not surprised one bit that this is happening, and be looking out for more stuff to happen behind the vaccine alone. Having said that, like, comment, subscribe. Thank you for listening.